That time of the month is always inconvenient and never fun. Adjustments to your bathroom routine aside, there are several other annoying symptoms of periods. Food cravings, sleep disturbances, bloating, mood changes, fatigue, tender breasts, and more. Most of which start even before your cycle hits, serving as ominous signs of what's soon to come. What causes these period cramps? In order to shed its lining, the muscles and blood vessels in the uterus contract. These contractions can cause cramping in the lower abdomen and back. Period cramping can feel differently for different women. Some have only mild discomfort, while others experience severe pain that can make everyday tasks difficult. Here are 5 ways to help get relief from menstrual cramps. Apply heat. Heat can help relax the muscles, contributing to cramping. So applying heat to your abdomen or back can help relieve your pain. Using a heating pad or soaking in a warm bath are great ways to ease period pain. Take a pain reliever. Since period cramps are painful, it's probably fairly obvious that pain relievers can make the list of remedies. For period pain, NSAIDs like aspirin and ibuprofen, that is non-steroidal anti-inflammatory drugs, are likely to work best since they can reduce prostaglandins, the hormones that stimulate the contractions leading to menstrual cramps. You can also use antispasmodic agents like mefenamic acid. When you're in pain, you may think it's best to just relax and get some rest, but physical activity is actually a natural pain reliever. Exercise stimulates the release of endorphins, which are chemicals produced by the body that help block the perception of pain. Avoid substances that make you feel bloated. While periods can give rise to specific food cravings, avoid eating salty foods like chips or fried foods that can cause water retention and worsen your symptoms. Listen to your body and take rest if required. Mood elevators like chocolate, ice cream can help and are completely harmless. Tea with cinnamon, fennel and ginger have been found to reduce period pain. When should you visit your doctor? If you are experiencing serious pain during your period, which makes it difficult for you to perform your routine activities, it's important to talk to your doctor. He or she will ask you about your symptoms and cycle and can recommend lifestyle changes that may help ease your pain, as well as perform a pelvic exam and prescribe medications if needed. There is no set age at which young girls should get their first period. Every woman has a different menstrual cycle with individual duration and length. Not every cycle is monthly. Cycle can vary from 3 to 7 days and frequency can be 21 to 35 days. There is no connection between menstrual cramps and eating sour foods. Higher content of salt may cause a bit of bloating but is otherwise harmless. The food you eat does not decide the flow of your periods. Thank goodness this is a myth. There is no reason to follow this idea as bathing and regular grooming rituals have no connection with one's menses. Taking warm baths twice a day will only help feel lighter as they ease muscle cramps. In fact, exercise is good for a sound body and mind and can even help reduce the pain due to menstrual cramps. There are no risks to regular physical activity like walking. The hymen is an elastic piece of tissue that can be found in many forms. While in some cases, tampons may break the hymen when inserted, this does not mean that the person is no longer a virgin. Losing your virginity isn't dependent on the disruption of a piece of tissue, but rather becoming sexually active. Periods are just a biological function of the body. Impurity lies in the mind, not in the uterus. Plants, unlike humans, do not discriminate. They thrive on good care like all of us. Menstruation is not contagious and causes no harm to anyone else in the same room. I hope this answered a lot of your queries about menstruation. Please comment below if you have any more queries.